Today I'm joined by Ashley Villarreal Fleeman. Ashley is a Spanish speaking SLP born in McAllen, Texas. She is a co owner and co founder of Amigos Pediatric Therapy Services, Inc. Ashley is ASHA certified and a BESPA state license. She earned her Master of Science in Speech Pathology from Harding University in Searcy, Arkansas. As a therapist who shares the cultural and linguistic background of the community she serves, Ashley takes pride in providing accessible, high-quality care to Spanish-speaking families. Thank you so much for coming.
Thank you so much for having me. I'm a big fan of y'all's work, and so I'm so excited to be here.
Thank
So
you.
happy to
We're
have
very
you.
happy to, we're very happy to have you here. So does that cover everything, or is there anything else you'd like to add before we talk about bilingual speech therapy?
I think that covers it. Thank you so much for that awesome introduction.
Of course. So, what motivated you to specialize in speech therapy and focus specifically on serving the Spanish speaking community?
That's a great question. My motivation actually stems from both personal and professional experiences. My little brother, which he would be so embarrassed for me to say this on a podcast, but he had speech therapy growing up, and he was only provided the therapy in English, even though we were a bilingual family. And so, as a bilingual individual myself and a student, I witnessed the challenges that language barriers can create, especially in healthcare and education. And during my studies and clinical training, I just saw a lack of resources for Spanish speaking families, which props to all the bilingual speech therapists now that are like active on TBT and keep us going. But then there wasn't any. So yeah, the lack of resources for Spanish speaking families, which, often lead to misdiagnosis and delayed interventions and just frustrations for both the children and the parents. So I just really wanted to bridge this gap by providing like high quality speech therapy services in Spanish and ensuring that these families receive the support that they need in a way that is obviously culturally and linguistically appropriate. And by doing that, we established the first all Spanish speaking bilingual outpatient therapy clinic in Central Arkansas so that we could ensure that this community had access to these critical services without language being an obstacle.
That's awesome. Can you tell us a little bit about how you started that or kind of what your first steps were in creating your clinic?
I think like many entrepreneurs and therapists, you have your own way of doing things, right? And your own resources. And I just felt like in the place that I was at before, which was a great setting, it was just, I wanted more of interactions with families because I know I have a child who receives speech therapy and occupational therapy. I wanted the parents to join in more and education more. So it kind of started like that. So I kind of just went on the side, like everybody does, treating patients from the public library, like outside of my 8 to 4 job. And it just built and it built within a fall semester to the point that I kept telling the public library, children's librarian, I promise we're going to get our own place. Like, I'm so sorry. So it just started out really small, which that's why I love y'all's podcast because it doesn't have to be like a brick and mortar kind of story. Like it can start out small and then grow into something bigger.
Yeah, that's awesome. So you were working for a different company, you're
hmm
starting to see some clients on the side. And as far as like referrals and how you were getting more involved in the community, was it mostly through the library or how are you reaching out to these families in need?
So actually, my one of my mentors, my CF mentor, she switched over from a developmental preschool setting, which we both were therapists at, to our state's hospital, children's hospital. And so, you provide all the resources and referrals. Like, okay, this parent wants more of a developmental preschool. This parent wants in daycare therapy. And so she knew that I was kind of that outpatient person. And so when parents were like, well, we want to be active in therapy. So she just started her and her team, which thank goodness too, I had been a part of as like a graduate student, and I was a student there, so they knew who I was, and so they were referring to me because our state hospital actually doesn't do therapy at the hospital. They just do evaluation, so they need to have a lot of resources of where to refer parents.
Awesome. Yeah, that makes sense. So
Mhm.
if there was another bilingual SLP out there and they're a little unsure of
Mhm.
how to offer bilingual services, but they do have those skills, what advice would you give them to get started, kind of like you did?
I would say first, look at your demographics, right? See how far you are physically, like from where you want to treat to where most of these families live. Because most of these children, hopefully, are receiving therapies at school, but or the birth to three are getting early intervention. Kind of see what the need is, but honestly, the first thing that I did was get very acquainted with our Medicaid guidelines for Arkansas and just make sure that I was credentialed and that I was up to date because I didn't know what it took. Even though I had been practicing for 6 to 7 years, I didn't fill out my own things when I first got out of graduate school. Like somebody did it for me. So just making sure I had all that. So I would start off first with, you know, making sure you have credentials with at least the insurance provider that most of these families have it, which for me was Medicaid. We have something called AR Medicaid for children here in Arkansas. So getting associated with that. And then also just kind of thinking of like, what would I charge for a self pay for a family that doesn't have much? And just kind of setting those boundaries and guidelines before actually getting started. And then honestly, just word of mouth. I've noticed that my community is not so much on advertising or going to talk to a doctor and saying, "Hey, refer to me." It's like just word of mouth, like, "Hey, do you have any friends that have kids? Like, I'm happy to do like a screener or something," and then kind of open the door that way.
Those are really great, like, actionable steps for people
Mm.
to start and how they
Yeah.
can start to look in their community for those
Mhm.
needs. I'm really excited to learn more about your clinic. I was looking at your website earlier. It's super cute. I love your
Thank
branding.
you. Thank you so much. I am the only like my husband and I are like the only like medical people in our friend group. So thank you to all my friends who are creators, creatives, social media gurus. They had our backs in this whole initiation, which I love because our name is Amigos, which a lot of people don't know our friends really helped, you know, have a nice website and nice social media. So every part of our company is ran or we like hire our friends to help us manage that because that's not our forte. That's not our strength.
That's awesome. Well, it definitely comes through, like, start to finish from how the
Thank
branding
you.
looks and the photos and everything. It's super cute. So
Thank
could you
you
tell
so
us a little
much.
bit more about your clinic? How does your clinic address the unique linguistic and cultural needs of your community versus even just a traditional therapy setting?
Yeah. Obviously, like with the name, we being a Spanish speaking clinic, we address this by conducting evaluations and therapy sessions entirely Spanish, English, or both Spanglish. We want to be able to meet that family wherever they are. And we educate the families on bilingualism, help them dispel myths about speech and language development and bilingual children. That's a big one. Which here recently, I'm like, is it the family or is it the providers? I don't know. We kind of have to do some education in both areas. And then just having culturally relevant therapy materials and just stories and activity that resonate with our clients' backgrounds and just making therapy more engaging and effective in that way. And then the second point to that is hiring qualified therapists who are already proficient in Spanish and have cultural competencies in the Latino community. Um, when I interview people, I kind of do a two-step system where I like get lunch with them or coffee or something. And I kind of just want to see like how much they understand of the culture, right? Because you can't really teach that. I mean, obviously you can stay educated on it, but some of the time you kind of just have to have your own experience with it, either in graduate school or growing up. So I know by the time that I hire that therapist, they understand the cultural values, the traditions, and the communication styles that influence development. And that allows us to just have a more personalized and effective therapy. So I think that just creates a stronger sense of trust and connection. And, that just leads to better outcomes.
Yeah, that's awesome. I love the idea of being able to get coffee with them and understand things
Yeah.
with the people
Yeah.
you hire as well.
Yeah, I love that too. And I wanted to ask you for other clinics that
Mhm.
are, private practice, but they don't have any bilingual SLPs. what would be your recommendation to them? And maybe they don't even, which is shocking, but like they don't know any bilingual SLPs. How can they find other clinics that have bilingual SLPs? Give us all of the recommendations.
I definitely, this is where I love podcasts, like y'all searching on podcasts and on social media. Oh my goodness, social media has been such a great resource. I mean, free resource. People are always sharing stuff on there. Um, but also like looking to other creators like on Teachers Pay Teachers and like speech therapists that are bilingual creating resources. But like, for example, one of my go-to websites is the Leaders Project. They have great resources on there for if you're not a Spanish speaking therapist, what should I do for this child whose, first language isn't English? But honestly, I would say like just bridging that gap is just reaching out to somebody that probably doesn't live in your state, like via Instagram or Facebook, like, hey, I have this kid that I need to test them. What do you suggest I do? I'm in a lot of those types of groups on Facebook, and people ask just great questions, and the response is always so welcoming and and educative.
Those are really great suggestions. And I think like the way that you market your brand is really important for bilingual SLPs to take note of because like I live in South Florida. There are
Yeah.
many bilingual SLPs, but when I tell you I don't know anybody, which is crazy, I don't. And I'm going on Google right now because it just reminded me that someone was asking the other day. And it just shows that the fact that you are highlighting that as your niche is so valuable to bilingual SLPs. Like they should, if that's something they want to focus on, it is going to take them so far because they're going to be known for that in their community. People are going to know to refer to them, to their practice for that. So I think anybody listening to this who is bilingual, take that and like apply it to your branding if you are open to it.
Yes, and we wanted the experience at it being Amigos from the moment you saw our sign or advertisement to the moment you call our phone. My wonderful receptionist and clinical coordinator, they speak Spanish when they answer the phone because we know that the moment somebody speaks English, they'll probably hang up. Another thing we do is that we know that our family sometimes don't want to answer their phone because they don't know they're going to be able to respond in English or Spanish. So we just follow up with a text message and Spanish. So just understanding that, and thank you for that because it was thought out in that way. Like, hey, like I know what that word means. I know that they'll speak what I speak there. I will
Yeah.
say though, on the contrary, there we've had families be like, so do you only serve Spanish speaking kids? And I'm like, no, we're friends. We serve everybody. So just, we serve all the children, but so it's kind of with this checks and balances, but I think it's definitely been positive.
Yeah, yeah, I could see where you have to figure out how
And
to balance that because you don't wanna turn people away either, but I think some of the steps that you've taken but sometimes and I've heard this too, like, when you're trying to help everybody, you end up helping no one, or not the
exactly.
right people. Like, this is something that I've been practicing lately, and I don't know if you can relate to this, but, like, setting firm boundaries with the type of clients that I am good at serving and then having a referral source to, send them out to. I got a referral for stuttering recently and I was like, I like this population. I could serve this population, but I just don't do it enough. I want to send them to somebody who lives and breathes this. So those suggestions you gave are so good for anybody who wants to kind of niche their practice down, especially focusing on bilingualism.
And I was going to add, you actually inspired me about those boundaries because I saw a recent Instagram post that you made. And, when you first start a business, you want to have business, but then you also have to like check yourself and say, you know what? I am not the good go-to stuttering person. I am definitely not the go-to feeding person. Even though those are interests of mine, that is not my strongest suit. As our clinic has grown and as I hire those therapists that have those strong interests. So then they can take lead on that. But yeah, I saw an Instagram post that you made about that or a story, can't remember. And I was like, you know what? She's right. There's plenty to go around and we're not the best person for that kid or that parent, at this
I
moment.
think it takes a lot for somebody to recognize that and know that,
Mhm.
like, really we're doing unethical work when we're taking
Yes.
on the
Mhm.
clients that we're not best able to serve, especially with those very particular populations, like, or I don't want to say rare, but you just don't see them as much, like AAC, apraxia,
Mhm.
stuttering, like they're much better served by somebody that like lives and breathes that. So I'm glad that it resonated with you.
An example for that for us is that our clinic right now, we didn't know, and this is just gets more logistical business wise. We didn't know how fast we were gonna grow. So we were conservative. We leased a space that was barely like 1,500, 1,800 square feet. Didn't put a lot of speech therapy rooms. We just had more like an open concept. So we started to get referrals for 16-year-olds, 17-year-olds, 18-year-olds. Well, if you look at our Instagram, it does look more like child's play and like just very, a loft and a swing. We do have a switch and we do have a projector. We can be accommodating and fun, but I just knew that when it was like physical therapy kiddos that were at that size, I mean, sometimes they're taller than some of the therapists.
Yeah.
I knew I didn't have the space for them, so I referred out, within the community because I just knew at this
Yeah.
moment we can't serve them.
Makes sense. Good
Mhm.
point.
I like a couple of things that you said about how you were kind of removing barriers for families to get access to speech therapy. I know, like you mentioned, a couple of ways with like the receptionist answering in Spanish or following up in a text in Spanish. Are there any other ways that you're kind of helping to reduce those barriers for families or for other people in the community to get access to these resources?
Another thing we do, which I know seems pretty common sense, but it does go a long way, and I've seen it not be done, is just having like intake paperwork in Spanish and English because I have a bilingual brain. So like if I'm filling out a paperwork that would be entirely in Spanish, like what is that word? Right, let me Google it. And sometimes in English it's the same. So just having some bilingual Spanish English intake paperwork that the families can fill out. And also in our evaluation reports and our summary, I have our therapist always summarize what, the results of the test and how many minutes are we recommending and the goals, just so the family, even though they probably don't care to read the entire report, they at least they get the gist at the very bottom. And so those are kind of some of the ways that we've kind of bridged some of those barriers.
That's awesome. I love that. Like little ways that you can just like help
Mm-hmm.
them, even if it's not something that they're looking for, it's still there for them
Yeah.
if they need it.
Mhm.
So what other like impact have you seen your clinic have in the Spanish speaking community in Central Arkansas since you started it?
I will say that the response from the community has been overwhelmingly positive, from families to providers that serve some of these underserved populations. And they just, the families have expressed to their pediatricians, like if they have expressed relief in finding a clinic where they don't have to struggle with are they going to answer in English or Spanish? I don't know, or just concerns about being misunderstood. And just honestly, like what happens in everyday life, like, hey, like I don't want to go because it's raining and my car doesn't really work that well. They understand that we're very accommodating and we get those kind of situations. But also, another way is just parents to just share that they feel so empowered, knowing that their children are receiving therapy tailored to their linguistic and cultural needs. Like, they love when we do little things, like even Arctic cards, that have like tortilla and you know what I mean? Like, and they appreciate that.
Yeah, that's awesome. Do you have any, I don't know, specific success stories or a family that like maybe sticks out in how you helped them?
Yes, actually, and his mom, oh my goodness, she's a top mom. Not just because she buys us tacos every now and then, but she the little boy went to visit this is the little boy that received all therapies. And so I've known him for a little bit now. He's probably one of our first patients when we started. He went to visit some family in Mexico with his mom. And when he came back, he was calling all the therapists and even my husband like Thea and Theo. So we were not like Miss Ashley. And Thea means aunt in Spanish. And so we're like, Thea Ashley, Theo Jeremiah. And I was just that alone was just so heartwarming because that that just shows how much he and I don't want to get teary eyed, but like that just shows how much he trusts us and loves us and like just he knows that we get him, you know? Another just like simple thing that I always share with some of our graduate students that we have is the moment they walk into the therapy room, it's just like, "Hola, ¿cómo estás? ¿Qué estás haciendo?" Like, just very like how the tia would talk, at a family gathering. Their eyes just open up and they're like, "Oh my goodness, they talk like me. They sound like me?" So, like, those 2 little things I feel like have been one of the things that, like, in my heart, I think about quite often. I'm like, "That is just it's just heartwarming." I'm like, "We're doing our job well."
That's so wonderful. I love that
Yeah.
story. I
I
had
know,
like
I know.
a similar experience in the clinic that I used to work in where uh, I I speak Spanish as well, but I spoke to one of the kids that my friend was seeing for OT in Spanish, and you could just see like his little eyes like light up. So I love
Yeah.
those like little moments where they can connect with you on a level that they didn't expect when they first came
Mhm.
in, and how I don't know how that can just affect their care. As far as like going forward with like continuing education or keeping different cultural components alive, or even just more awareness within your office and clinic? Are there different things that you do to ensure that, or to share things with your clinicians? Just to, I don't know, like share different like cultural values that might help kids, since like they could be coming from so many different backgrounds, or
Mhm.
every country has like different traditions
Yeah.
and things. Yeah.
Mhm. Yeah. We actually had the pleasure of having an occupational therapy capstone student. So now, OT gets their doctorate. And so she did her capstone at our clinic. And that's exactly what she did. She did like a training, a module training of like culture competency and pediatric therapy, specifically for occupational therapy, but a lot of it was so relevant for physical therapy and speech therapy. So she shared a little bit from this country, and little words for jump or come here, or like, where are you? What's your name? And it did get increasingly harder as the modules went on. But I can assure you that whoever, like, completes those, they'll probably feel like, "Okay, I got this." Like, I think well, at least I have that tool. Thankfully, some of my therapists haven't needed that because they've had experience elsewhere, or, they've either had a mentor that kinda, like, has guided them through this, but that has been a training, resource that I've actually used at our clinic. I'm like, "Hey, can you watch these modules?" Just so you can see, like, kinda like the families we serve and how you can serve them best. So that was just provided to us. It was part of her capstone project, but we're forever thankful for it.
That's awesome. And to have it
Yeah.
like in clinic is so
Yes,
cool.
yes.
Yeah. Are there any specific areas of speech pathology that you aim to expand or innovate within your clinic to better serve your population?
Yes. I feel like we're just lifelong learners as therapists. I feel like I'm always looking for ways to grow and improve our services. One of my goals is to develop more like community outreach programs to educate parents, teachers, and healthcare providers about bilingual language development and the importance of culturally responsive therapy. I feel like that's just one of my biggest goals for the year and for the next few years. And one of the ways that I'm kind of taking action is that I have a really dear friend who is starting a nonprofit called Coloriendo Nuestras Vidas, which is a group of moms with children that have autism that are older, like they're like the 15 or 14 plus. I think she's starting to open it up more with just children with disabilities, but she lets me like tag along and sit in those meetings, and then I be the professional that gives the input on like language development or sensory issues and stuff like that. So I'm kind of taking she comes to learn from me and I go to learn from her and I sit in those meetings. But that's one area that I really want to see Amigos bridge that gap too. It's like you just don't have to be receiving therapy from us. We want to be able to go out there and educate you too.
That's awesome. Yeah, to be able to serve the community and just give back even if they don't need speech or OT or PT.
Mhm. Mhm.
Yeah. What
Yeah.
advice would you have for other bilingual therapists looking to grow or to specialize? Maybe they want to start their own clinic, or they already have a clinic and they're looking to grow the bilingual aspect of it.
I will say just jump into it. I know that I was always like, use this metaphor. I was like at the edge of a cliff and I was like, should I go? Should I not go? Should I jump in? First of all, I'm scared of heights. And I just like would question myself. I'm like, should I even just jump into this? All these unknowns, all this billing, all this networking. And for those that are thinking about it, just do it. You'll feel this fulfillment and just sense of like you're you're making a difference, which I know you already are, because I feel like our profession is just so rewarding. But if you're thinking about doing it, I feel like just take that first step and just put yourself out there. And you guys probably have talked plenty of times on this podcast is it just starts with one patient, just and it starts with one family. And then you kind of just start and see like, okay, can I do this? And then for those that are actively going and are doing it, I would suggest to always check in with yourself. I feel like at least once a week, I look at my planner or I look at my gratitude journal. I'm like, okay, what areas did I say I wanted to keep growing? For the example, the question that you asked me, like, which areas do I want to grow and improvise? Like, how am I doing that? Have I attended a meeting with Coloreando Nuestras Vidas this month or our Hispanic outreach program here in North Little Rock called Seis Puentes that I sit at the board of? Have I attended one of their programs for the community? Just checking in on yourself on that, that mission that you've created for your business. So just really checking in and just taking that first step would be one of my biggest advice. And kind of like piggybacking off what you said earlier, take a reflection of what you would want as a patient in a family. And like for me was the name Amigos. Like I wanted it to be welcoming just by reading the location and like what it meant. And just kind of like taking a deep dive. I'm like, okay, what's important to me? And to me was like the friendship, right? But also the language barrier aspect. And so just kind of reflecting on those things. And probably like how everybody says a niche, right? What's your niche? What are you good at? Like Vanita said earlier, we're not all good at everything. And for me, to be honest, I don't think bilingual, Spanish, English language development was my favorite. Like when I graduated graduate school, I wanted to be in the NICU. I wanted to be more like a med SLP. And then look where I am now. Nothing to do with that. I mean, we end up feeding kids, but that's probably all medical as it gets. So just kind of like taking a look of what you're good at.
That's a really good reminder. It's something I'm constantly reminded. I don't know if you feel like this. Some of the stuff that you're so good at can kind of bore you after a while.
Yeah.
Like,
Yes.
I hate saying this, but like AAC, I feel like I've done so many continuing education, done so many jobs related to it that I'm like, I want to try something new, but I always keep getting brought back to that. So, like you're describing, it's because that's like what you can help people the most with. So, I think that that's a really great reminder. I wanted to ask you some
Yeah.
more specific questions. When did
Mhm.
you know it was time to get your clinic? And then what clinic costs were you comfortable with? Because you said your space was 1,500, which is like pretty big. I've recently been looking at spaces that were around like 400, but I know my fear is that it will grow fast because I feel like once I like commit, I'm going to go all in. And then there's no stopping that faucet at that point, you know?
No, I feel like so we got our business license like April 2023. And then August, I felt more comfortable. Like, okay, I made a good relationship with the people at the library. They let me see kids there. And it started out like 2 to 3 kids. And then it went from 3 to 7 kids. And I'm like, okay, I'm invading in their space. The things that they have going. They were so happy because they're like, you're getting people in the door. People don't come to our baby readings or, whatnot. But I just knew that, especially like with a challenging kiddo, that would scream and cry or didn't separate well from mom, like it echoes in there. So I just kind of started getting this feeling like, okay, I think we need to look at spaces. And we always knew that Amigos was just not going to be speech therapy. And I think that's another big difference because my husband's an OT and we actually have worked together most of our careers. We shared an office right next to each other. People ask us all the time, like, how do you do that? I'm like, I don't know. But we worked together, which I really liked because I felt like the kids that we shared at our previous job, like they made progress because I understood what they were doing and he understood what I was trying to do. And he speaks Spanish. And so I think that helped. Um, but yeah, so when we kind of started outgrowing the library, we started looking at spaces and kind of like you, we're like, okay, well, we need to start something small, which he's the like more conservative and like logical person. And I'm like, no, I think when you go bigger, he's like, no, when you go smaller. And so I was like, well, there's 3 therapists and then there's 3 kids, that's 6 people. And I don't know if you guys know this, but like we have an open concept therapy treatment room. We only have one sensory room and we have a bathroom and we have a therapy work room. So speech therapists, we don't have our own offices. That comes because what you were saying. I just got so bored being in a room by myself with the kid all the time, which to be fair, the place that I used to work, it was like back to back to back. It was like a school setting. And so
Mhm.
I'm like, I want to socialize with some of my colleagues, like, especially because of COVID. I'm like, I don't want to be trapped in
Yeah.
a room. So I think that's why we went bigger because I knew that the concept was going to be like an open concept gym. And so we wanted to be able to fit a loft. We wanted to fit a swing, a crash pad, a little baby area, and like a big school lunch table, that we could sit and work. And so I think that's what made us go bigger. I will tell you from experience, just a year and a half in, go bigger. Because in a year, we went from having 2 therapists to 10 because of the need. So there's 4
Wow.
bilingual speech therapists, 3 OTs, and 2 PTs, and then our receptionist. And that happened in a year. Like we blinked and it's like, oh my goodness, we have a crew. So I would say just think about all the toys you have and like how free you want your client to move around and like organically and like play wise. And I would kind of go that way. And if you're thinking like, I want to hire somebody to come maybe see those after school kids that I can't because I'm a mom, like kind of think about those areas of your business that you want to be able to serve, but you can't at the moment. Like I don't see any kids from 3 to 5 because I want to go pick up my babies. But I have some of these younger therapists are like, I'll come in at 10 and I'll end at 5. I'm like, great.
Perfect. It
Yes.
sounds like amazing and it sounds different. I've toyed with the concept of doing like open floor plan, but some people have mentioned HIPAA with me. How do you get around that? I feel like it's like
So
being in a school, right? If you're getting treatment at a school in a group setting, then like it's the same thing, right?
yeah, so we have a receptionist like waiting area. So the parents, I would say like 90% of our parents, they want to chat and be with other parents in the waiting room.
Yeah.
Our clinic is in a very busy area. So they want to go to Target. They want to go run that Walmart order without their child. So an hour, they can go do a lot in an hour or two.
Mhm.
And so it's only the therapist and the child that go back into the treatment room. For evaluations, we do walk the parents into that intake room where we like ask more questions and it's more one-on-one. Or let's say a child is having a harder time, we go into that sensory room and we close the door. Have we had parents say, "Hey, I want to go in every session?" And we're like, "Yeah, that's fine, but we'll be in the sensory room. Like we can't be in the big open room." And we share like you wouldn't want other people to know it kind of what's going on in your
Right.
child's treatment plan. And they're super respectful because then they're like, "Yeah, you're right. I don't want everybody to know that he's working on toileting, because he's 4." So I think they were very receptive to it. But another thing that we kinda do a little different, and I don't know if this is controversial, but it's worked for us, is we don't have our assigned caseloads. Like, so I don't see the same 10 kids every week. We kind of like we schedule them and whatever therapist is available sees that therapist, but that's really helped with generalization of the skills. Like, so I wish I could have done like a study on this because these children are meeting these therapy goals like quickly because we know that they're understanding the concept from different therapists and actually generalizing the skill. So that kind of allowed us to be flexible in scheduling and more, again, a barrier for families who can't come in all the time. And we're just more flexible with that. So the open space and then the flexibility of the therapist, that's really helped.
That's awesome. Yeah, imagine if you write the goals properly where it's very
Hmm.
easy for the next therapist to
Hmm.
replicate what you're doing, then you could see progress
Hmm.
across the therapist. Sounds
Yeah.
great.
And we have kids obviously that favor other
Yeah.
therapists. We have a person that loves AAC and she's really good with the speech generative device. So she tends to get some of those kids, right? I kind of work more with the more like birth, like 3 to 5, you know, autistic children, and just more sensory. Again, I think of my husband's an OT and I just work well with them. And then I have a therapist who actually was at the hospital, children's hospital. So she does more like feeding, failure to thrive kind of kiddos that kind of follow up in these clinics. So, and then I have a hearing, you know what I mean? So we
Mhm.
do kind of have some kids that get scheduled on our caseloads, but we also are very flexible.
That's great.
Yeah, that's a really good idea to be able to also to like build that community even in like within the clinic, like all the kids like
Hmm.
know all the therapists and the therapists get to know like
Hmm.
all the kids. With
Yeah.
that open concept, are there any challenges that you have with like noise level or is there different ways that you try to like get around that so you can keep that open concept?
Yes. So that actually was their biggest red flag of like when it's time to open up a second location, which we're so excited to say, like we are opening up a second location later this year. And it's because we know that the most that there could be in that open treatment is 4 therapists total, like with 4 other kids, so 8 people in there. So honestly, I feel like everybody is just has the pragmatic skills and social skills that they know, like, hey, we're going to go work in this corner and they're working over here. And if a child wants to go play, they know how to redirect them. Obviously, with some of more like noisy, like environments, if the child can't tolerate that, then we'll use that sensory room. I don't know, I feel like everybody's really aware of what's going on and what kids are coming in. We kind of do like a roll call, like, okay, next hour, so and so is coming in. Hey, he likes the Bluey and the bingo toys. How about we like hide them for this session because then he'll fight if somebody else gets it. You know what I mean? Like we kind of prepare in that way as a team.
That's a good idea. So 4 adults, 4 children kind of makes it more manageable for
Yes. Other
as far
than
as
that,
numbers.
it's crazy. Yeah. More
Well,
than that, it's
congratulations
crazy.
on the second
Thank you.
location. That's
Thank
awesome.
you so much.
The other question I'm sure a lot of people are gonna have, are you only private pay or do you also take insurance?
We hardly see any like self pay, as we call it. I do take some, but we are more specifically Medicaid, like Medicaid funded. Like Medicaid is like the number one insurance that we see and take. That's most of our referrals. I do have other private insurances, which I would say if you're a business owner, that those are your headaches. Private insurance is such a headache. I don't know. That's been a tough one. But we've learned, and now I know as the year comes up which ones I renew and which ones I'm like, no, no thanks.
Mhm.
But I think those are just growing pains that you kind of figure out which ones work for your clinic and for your families.
Mm. And how do you kind of base some of your prices off of, or do you have like a different framework for basing your prices?
For example, I have a great relationship with the Mexican consulate here in Little Rock. And so we've actually like stay in contact like with a family, let's say that they don't have insurance for whatever reason. I always invite the family to kind of do like an interview with me. Like we kind of talk about some of their monthly expenses, like what are their priorities for their child. And I kind of base it off of that. And honestly, it's my business and I'm the one that would treat them like, for example, like a lawyer, they do like pro bono stuff, right? And some of these kids, I'm like, I'll charge you X for the next 4 sessions. And it's up to me. It's like my discretion. I've had therapists in my clinic say, hey, I want to do that too. Cause I know there's a lot of kiddos that don't have insurance. Can I block some of my time if that case comes up? And so we kind of just base it on the family's current expensive. I do ask them to bring me like their bills and like, some of the things that they have going on, just so they know I'm being fair to other families. And it's not something really we promote, but like I said, the Mexican consulate knows we do that. Some of our favorite providers know that we do that. So they know when to like reach out to me personal and my personal email and be like, hey, can you take a look at this family? What do you think you can do for them? And what's that's created a community of providers, not just therapy, but like dentists, eye doctors that are willing to do the same for these families that are severely underserved. And so we've kind of just have this like communication, like, hey, I have this little girl that I'm seeing for Arctic, but I don't even think it's an articulation thing. I just think her teeth are completely rotted. There's so much sensitivity. Can you like see her for like a teeth screen or dental screening? And we just have a great community that's willing to serve. And so that's kinda how I base it, just like a personal, like, interview with the parents and kind of base cost on that.
That's great. I feel like it kind of makes like a snowball effect too. Like if you're able
Mhm,
to give more of your time and resources, it's going to be infectious for other people to want to do the same
mhm,
too for these
mhm.
families who might need some extra support or just more access to care.
Yeah.
So that's a really wonderful avenue to go. Thank you for
Mhm.
sharing that.
Oh, yeah.
So we've had a really incredible conversation today and we covered a lot. We really learned and were inspired by you on how you specialize in bilingual speech therapy and how your clinic is breaking down language and cultural barriers and making such a wonderful impact on your community in Central Arkansas. So, thank you so much for coming.
Thank you guys again for having this platform and just sharing it with the world. I know I'm very appreciative of everything you guys do.
Thank you.
Thank you, Ashley. It was such a pleasure speaking with you and learning more about your business. And congratulations on all your growth and your second business location. And we look forward to following along on your journey.
Thank you.
If you found this episode helpful, share it with another SLP who's looking to grow their practice. And if you're enjoying the show, make sure to subscribe and leave a quick review. It really helps more people find these conversations. Thanks for listening, and we'll catch you in the next episode.